The 2025 Yrrh Regional Referral Hospital Joint Performance Review Mission, together with the cluster districts such as Yumbe, Koboko, Moyo, Obongi and Ajuman district, has registered great improvement in most of the health indicators compared to 2024 Regional Joint Performance Review Mission. This was revealed in the 2-day session from 14th to 15th August 2025, hosted by Moyo District Local Government, organized by Yumbe Regional Referral Hospital, with support from Ministry of Health and other partners such as UNICEF, UNHCR, Muni University, medical teams, among others, attracting different stakeholders such as the medical personnel from Yumbe Regional Referral Hospital and across the 5 cluster districts, more so the district representatives and the resident district commissioners across the 5 cluster districts. Dr. Odong Patukluedo, Senior Executive Consultant at Yumbe Regional Referral Hospital, says there is great improvement in various sectors, more especially in staffing, compared to the last edition.
As you compare with the previous year, there has been some progress in a number of areas. One, in the area of staffing. As we speak now, Yumbe Regional Referral Hospital now has more consultants, associate consultant, medical officers. For this particular round of interns, the Ministry of Health have also increased our number of interns, and this is because they have now seen evidence in us that we have the capacity to supervise interns. The total number of interns that are allocated to us is 39. And these interns, if we mentor them and train them for a few weeks, they'll be definitely able to offer more and better services to our people.
Whereas Dr. Mubarak Nasur, consultant of pediatrician, who doubles as the Deputy Hospital Director at Yumbe Regional Referral Hospital, says, indeed there is a drastic reduction in the cases of some common diseases, especially malaria, compared to last performance review mission.
If we look at the reviews we've had in the last 3 years, when we used to talk about the top most causes of disease burden in our region, malaria used to be number 1, followed by maybe respiratory infections like pneumonia, and then diarrheal diseases would come as number 3. But today, from the results that have been presented, we saw that malaria has come from the top most cause of disease and OPD attendances, from over 40% or 50% that the cases we used to have. Even among the inpatients, we used to get about 30% being what? Caused by malaria. But these statistics, as we saw, has come, and most districts are giving us very impressive results from what we've seen.
Meanwhile, Dr. Lulu Henry Leko, Assistant District Health Officer for Ajuman District, laments that the annual performance review mission helps to analyze the performance of every district in health sector.
Every year, therefore, we take a moment off with each district preparing presentation on how they have performed in these key health indicators per facility, and it gives a consolidated district performance that will later on be presented to key stakeholders in this joint review mission. The key action points generated from this joint review is consolidated and presented at the National Health Sector Performance Review Mission. And that is where the performance by the health sector across the country is being later on presented, the overall performance.
One of the biostatisticians at Yumbe Regional Referral Hospital says it has been a success because various stakeholders have shared great insights.
It has been a success. We've been able to share great insights. Yes, we've been able to review our performance, and as we were able to see, to reflect on the performance for the past financial year and this year under review, we're able to note the great improvement in performance across the districts. And key to note, we've been able to have a number of deliberations which we are going to act on to why that come September 2026, as we host the second joint review mission, we are doing our best. Facilities that are still lagging behind, districts that are still lagging behind, we want all of them to be to the top of the game.
Agnes Bakotsandia, Commissioner Nursing and Midwifery under Minister of Health, says the issue of staffing still remains a problem, therefore encourages the various districts to revisit their recruitment plans.
Efforts have been made as actions for some of the 5 districts. They are able to really implement in the key areas of performance as designated by Minister of Health, the indicators. Nevertheless, the issue of staffing still remains a big challenge. There's inadequate staffing, which compromises the care, and of course the shortages were so pronounced in various levels of health facilities. In our actions, we have now asked and also tasked the districts to revisit their recruitment plans. I'm happy that many of them have already plans which are in place, and what they need is to get in touch with public service such that this plan, this recruitment, the availability of the wages are being approved, and then they can be able to advertise and also recruit. And we are of version that this will be handled at district by district, because each district has different level and has different problems in regarding recruitment.
Regional Annual Joint Review Mission is an annual activity across the country in which the various regional hospitals sit together with their cluster districts to analyze the key health indicators so as to make adjustments in terms of improvements. Orak Benson Pastore compiling the story.